Courtney Cox is admitted to using it to age gracefully, and other celebrities report it keeps them looking refreshed. So is Botox right for you? And what are dermal fillers? Well, Dr. Germain of Germain Dermatology is here to give us all the details. And she's here with a friend, a beautiful friend. You were beautiful before. But you've got a little something going on. So Botox, Dr. Germain, everybody at one time, they said that's just for Hollywood. I can't afford that. I can't do it. But now it's very open topic.
It's definitely for everyone, really. You know, they used to think that Botox made you look frozen, but that's far from the truth now. Actually, when it's done correctly and done well, it can make you look so much younger. Just taking away those 11s that people get in the middle of their eyebrows, I think takes away 10 years. And then softening the lines in your forehead, softening the lines around your eyes, it works very well.
So it doesn't have to, I think that we need to also say, though, Dr. Germain, that you're very good at what you do. Some people do too much.
Right. So, you know, I try very hard to have good outcomes, you know, for my patients. I want them to be happy, and I want them to look good. I want them to look like them, but better. I want them to feel better about themselves. So actually using more is not better. And keeping up with Botox and starting out with just one area and adding in as you go along, a lot of doctors do too much, and that's when people start to look bad.
Okay, so what we're talking about here, though, with Lisa, what did you get done?
Okay, so Lisa, she had some Botox done, and she also had some filler done.
Okay.
And so, you know,
this is what Lisa looked like before. Lisa, I mean, it's funny. It's just, I can't. This is amazing results that you've got here, though.
I really didn't know that I looked like that when I first came to Dr. Germain, honestly.
Until
you know, I was coming in, it was about 5 years ago. I went in for like a skin check just to see Dr. Germain. She had a great reputation.
Yeah.
So I went in, and she just looked at me. She must have seen some type of potential in me. She said, and little by little, she just knew how to make me look better, feel better, just by tweaking me.
And what I love about what you do, though, Dr. Germain, you give us a little, and then you wait a minute, and then you see if it's not, I'm just going to inject the entire syringe in.
And I think that's what a lot of people do. Like, a lot of doctors make people look heavy because they're trying to fill lines, but actually want to lift the face up. And that's what I did for Lisa. I kind of lifted her face up, didn't make her look like a Beverly Hills housewife, but gave her her lips back just to give her.
Beautiful.
Yeah, she does. And you know what about Lisa is that she feels better about herself.
Right.
So that's the most important thing.
And she hit the nail on the head earlier when we were talking. She feels like herself. She feels like she looks like herself, but she just looks better. And speaking of looking better, let's show some of these before and after pictures. That's Lisa again, and you see Lisa here live and in color. And then we've got, stop it, Lisa, you look good. Now, what did we do here, Dr. Germain?
So I did Botox on this woman, and I really wanted to show this because she was coming into me saying that people thought she looked grumpy and unapproachable. After a good full night's rest, she would come in the morning, and her colleagues would say that she looked tired. So just taking away those lines in the middle of her forehead, this is just Botox. It just makes her look so much younger and refreshed. It's not, again, making her look different. It's making her look better.
My goodness. Okay, let's go to the next one.
Now, this is kind of an advanced way to do fillers.
It doesn't even look like the same person,
Dr.
Germain.
And she looks so much better, so much younger. So, again, a lot of doctors try to fill lines, and when you fill lines, you can actually make someone look older and heavier. It's not about the lines, it's about lifting the face, and it's hard for people to understand that because everybody thinks that fillers are just really to fill lines. But what I did with her is I filled her temporal area, I filled the hollows in front of her ears, and it just picked her face up, and I think she looks at least 10 years younger.
So can you get something injected in the lip, Dr. Germain, because her lips look fuller? Or
Well, what I did is I filled around her mouth a little bit and actually picked up her lip, because as you get older, your lips kind of turn in a little bit. The distance between your nose and your lip increases, so it pulls your lip in a little. So just by not even injecting anything in her lips, it pulled her lip up. Nothing was injected in her lips.
My goodness. So, okay, so let's look at the next one, as if we didn't have enough to go on.
Yes,
look at this.
I just wanted to show this because this is clearly just filling lines. And you can fill lines. You can fill the parentheses lines. You can fill the puppet lines in your lower face. You can fill the lines around your mouth, the so-called smoker's lines, which really are not from smoking, and the lines in your lips. But this was just filling the nasolabial fold, those parentheses. And I wanted to show that because that does make you look younger, but that's not the complete answer.
So there's a difference between fillers and Botox.
Yes.
So we do need to make the, and then is this just one time? Is that just an injection
Yeah, that's just one time. But like you said, I like to start off slow. If people are just starting, Rome wasn't built in a day. You don't have to do everything all at once. And I think it's much better and much safer for the patient, and the patients are happier when you start off with little bits at a time.
And do you find that's what happened, Lisa, when you went,
Absolutely.
just maybe even having that consultation and just that conversation with
Yes.
Dr. Germain
Yes.
would help?
So Lisa started out just doing Botox.
Yes.
For actually the first year,
Yeah.
she just did Botox, and then she added little things at a time. That was 5 years ago,
Yeah.
that picture.
So it's all been very gradual.
Well-
And people would never know that I did anything really. It's just that they occasionally people say, you look rested, or you look really good.
And
Yeah.
men and women alike can get Botox
Yes.
or fillers.
Yes, we have a lot of men that come to see us as well. I mean, men want to look good too.
Well, that's for sure, because they got to keep up with beautiful women like Lisa.
And
Oh, come on, Lisa. You know you look gorgeous. So what we have right here, Dr. Germain, is just kind of all of the different products. And because
Yeah.
we hear all of these different things and see all these different ads all the time.
Right.
They're all different.
They're all different, and I use them in different areas for different reasons. And you really just need to go to someone who knows what they're doing, who has good outcomes, and someone that you can trust.
And you've done the most injections. You know what's going on.
Yeah, so I'm very happy that I do the most injections out of anybody in South Carolina. Thanks, Lisa.
Wouldn't go to anybody else.
You need to give Dr. Germain a call, though, because she's very busy and it's very difficult to catch up with her, but you can always get an appointment. You always can do that. You can find them at 843-881-4440. And I just want to talk a little bit about that state-of-the-art facility that you have built, Dr. Germain.
Thank you.
What's the name of the street that you're on?
It's Seacoast Parkway.
Seacoast Parkway. An amazing building, and you've got the medical side and the cosmetic side.
Medical is very important to me too. I know sometimes we emphasize the cosmetic, but of course staying out of the sun is one of the best things you can do for anti-aging.
Okay, so I need to definitely work on that. Lisa, you look great.
Thank
You
you.
really
Thank
do.
you.
So
Yeah,
thank
you're
you so
great.
very much for coming. You were a great sport
Well-
for coming and showing us the before picture.
If it weren't for Dr. Germain, I
There you
mean,
go.
really, I feel so much better about myself. It's
Well,
amazing.
you look beautiful.
Thank
and
you.
make sure that you give Dr. Germain a call. Like we said, she's located over there on Seacoast Parkway. You can also find her on Twitter, on Facebook, and you can find her on the web. You're a social media queen.
Wow, thank you. Thanks for having me.
Thanks for coming, Dr. Germain. We appreciate it. Thank you, Lisa.
Thank you.
All right, we're back with more Low Country Live coming up right after the break. Stay with us.